The narrative of a young Cameroonian doctor, visionary, compassionate, and love for country. His walk in the dusty paths of his neighborhood, Tam Tam in Yaoundé, reminiscent of his childhood days alongside his German wife. Sad childhood moments may have been the motivation for the Cameroonian surgeon.
I was born here in Yaoundé. We live here in this neighborhood, and I used to have a lot of friends here. They used to go to school. I used to go to school, to primary school, Bambis, and I used to play here football with my friends. And one day he has an injury during the game. And then we went to his parents to tell them that he has an injury and he has to go to the hospital. The parents didn't have enough money to bring the child, my friend, to the hospital. With the time, the injury was infected and he died because of this injury, because of the infection. And it was a very difficult time for me because I was, I don't know if I was 10 years old, something like that. And I was asking myself why he died like that. He was 10 years old, he didn't do anything bad to pass away like that, you know. And I was thinking about what can I do, and I was a child, and I told her, okay, it would be good for me to study medicine, and so I can open a hospital and try to treat people.
The desire to be an instrument of change, a community worker, so to say. His parents, Mr. and Mrs. Gnipieven, remember a stubborn young man whose driving force has always been the desire to succeed.
Pour moi, c'était une première d'avoir un fils, non? Bon, je me suis senti autrement. Je n'étais plus le petit là. Donc j'avais déjà un enfant. J'avais grandi à travers ça. Je m'appelle, le jour où il est né, on est parti, c'était dans quel bois de nuit là? Le jour là, oui, c'était en face du Capitole à l'époque. Ça, c'est, lui, il est un battant hein, depuis le bas âge. Je peux vous dire, il m'a beaucoup gêné quand il fréquentait. Au lycée, c'est lui qui choisissait ses répétiteurs. Et il les congédiait. Je me rappelle, il y a un étudiant de l'université, d'un gars, on dirait qu'il lui donne les cours de quoi. Il a trouvé que ce monsieur n'avait pas le niveau. Il s'est passé de lui, il est parti chercher un autre professeur. Je me suis retrouvé, le monsieur vient me dire, mais votre fils me doit. Je dis, mais il doit quoi? Il doit 10 000 francs. Qu'est-ce qui se passe avec 10 000? Non, je lui ai répété, bon, si ce n'est que ça. Un enfant qui cherche par lui-même son répétiteur, je payais, bon. Donc, je m'appelle, l'autre jour quand nous étions à l'inauguration, il y a une ma nièce qui m'a dit, est-ce que tu sais que cet enfant, depuis le lycée, il était toujours dans les livres, il était toujours en train de trouver une solution, de chercher la solution à des problèmes. Que ce soit un problème de physique, de mathématiques, il était toujours dans les livres. Jusqu'aujourd'hui, quand il suit un dossier, même le dossier de ces projets-là, il ne te laisse pas tranquille. Hein.
Succeeding in providing proper health care, a major need in his country.
We are a family, and we are really a family with a strong bond. So we stick to each other, we help each other. If my brother has a dream, has a dream for the future of Cameroon, it is my duty as a small brother to be on his side. At his side, to be there to contribute, to give my small contribution to this project. He spoke about it like 5 years ago. We were thinking about what it's going to be. It's going to be a small one, a big one, be on psychiatry or offering general services. And today we are offering so much services, beginning from medical general and surgery and everything for children. So it is when I'm thinking about it, I have to smile, because it's at the beginning we're just dreamers. My brother was a dreamer to offer the solution. And now we are so proud to see this dream became true.
The birth child of a collective initiative, the Centre Médical Dr. Gnipieven Tekombo, located in the outskirts of Yaoundé.
We choose to build the hospital here because we don't have a medical center here, and the people have to go far away to the city Yaoundé to have a treatment, and that's why we decided to solve this problem and then open a medical center here so we can treat the population around Semalen.
Ntun, a third-degree chiefdom along the road to Nsimalen, main gateway into the city capital Yaoundé via its international airport. Dr. Gnipieven evaluates costs of investment in terms of efforts put in by friends, family, and sympathizers. Priceless. On a land surface of 3,500 meters square, the current building occupies over 500 meters square. 8 major health services offered.
The equipment here is from Switzerland, where I have my clinic, and we can treat all the patients who have any problem with the surgery. We can operate people here, all kind of operation we can do here. And we have Eastern surgeons. They will come here and they will operate people. They will come from Cameroon, from Yaoundé, from Switzerland, from Germany, and the most important thing for us is to operate people like we operate in Switzerland or abroad. This is our purpose. We have a new generation equipment here, and with the equipment we can treat people very well.
Mother and child health care is a major cause for concern in local communities in Cameroon in general.
The project in neonatology is very important because we have a lot of premature babies and they die, and that's why it's very important for us to avoid that we can save babies, premature baby, when so they can live, they can grow up very well. And that's why we decided to open this department. It's very, very important for us. In Cameroon, a big problem that there's young girls. They have babies. They are like 15 till 19 years old, pregnant, and they have babies, and they cannot afford to go to the hospital with these children. We saw that in the opening of the hospital that we have such kind of problem. We have the treatment here to see for the consultation only 5,000 francs CFA, and there are a lot of children, we can say young mothers, they don't have enough money for the consultation. We need the help of people who can help us, support us in this project, that they can finance such kind of cases.
We can do so many laboratory tests, and example hematology tests for the full blood count. That permits us to know the quantity of hemoglobin, red blood cells, white blood cells that the patient has. Parasitology for the worms, earthworms, eggs, and microfilarials. We have the ELISA for the HIV, hepatitis B, and all the viruses. We will look for the antigens and the antibodies if they are present in the blood or in the serum. That permits us to give a diagnosis that will help the doctor to give a good treatment for the patient. For the moment, no, we are the only ones around here up to, I think, Mesamundongo. We are the only health facility we have in this area.
In the beginning, when we started to plan this project, we wanted to have a medical center that when people come here, they can have everything. The radiology, pediatric, neonatology, pharmacy, we have laboratory, general medicine, surgery. The main department that you see in the hospital, most hospital. The vision, I started to have this vision 22 years ago when I got my baccalaureate, and I went to Europe, especially to study medicine because I wanted to do something in my country, and I knew that to open a medical center, I have to understand what is medicine. I have to be a medical doctor, and that's why I studied medicine, and it was very important for me to have in the country where I live, Switzerland, to have my own clinic, to have experience too, because the experience that I get there in Switzerland, I can bring this experience here in Cameroon, and that's why that was the plan, And I opened my hospital, my clinic in Switzerland 2016, and I decided to have the foundation 2018, and then we started to work with the team in Europe and in Cameroon. It was not so easy, but I am very happy to see that the dream comes true, and we hope that we together will ameliorate the treatment of the people in Cameroon. Yes, it was not easy for me because I have a family, I have 3 kids, I am married, and I have my own clinic. I work in the clinic 12 hours in a day, and besides I have to work for the project. And I am very happy because I had more than 100 people who work every day for this project. People, volunteers that helped me to accomplish this dream. The project costs 1 billion francs CFA, but that is only the cash, because there are a lot of people who are saying more than 100 people, they work every day for this project and they didn't get paid. I mean, when you summarize everything, it's more than 1 billion francs CFA.
A breath of fresh air for Ntun village with a population of around 1,000 people. The chiefdom, with no proper healthcare facility before now, grabs the stretched hand extended by a Cameroonian whose will is to be the change he wants to see.
Oh, on avait des problèmes. Là, on souffrait. Peut-être on pousse dans la brouette pour arriver au goudron. Peut-être là, arrivé au goudron, la personne est morte. Bon, on rentre. Maintenant, nous avons toutes les possibilités. Quand nous avons un truc comme ça chez nous, là, c'est une fierté, une grande fierté. Pour nous, ce n'est pas pour nous, les autres, pour tout le monde, pour tout le Cameroun. Peut-être que tu as une femme qui veut accoucher, il n'y a pas de voiture, comme ma vieille là est malade. Il faut, si on peut la transporter dans la brouette, on l'amène là tout de suite et puis c'est bon. J'invite tout le monde, toute la population des Etenga, tout le monde, tout le Cameroun. Je suis très fier, très ému, très content.
For the active diaspora, giving back to motherland is concrete evidence of patriotism.